Hello everyone, my name is Robert Melvitz and welcome to our webinar Doctors Going to Sweden Part 5. And these are healthcare webinars suitable for all kind of healthcare professionals intending to move to Sweden and work there as healthcare professional. I also want to emphasize that this is Part 5, which means that there are other 4 parts you can review if you want to get more insight about this topic. And also, guys, please mute your microphones and please turn on your camera. I guess you are enjoying to see me while I'm talking. You enjoy when you can see who is talking to you. Equally, it is great for us to see whom are we talking to, right? It's a mutual feeling. And this webinar will be recorded per your request. So in case you are working, you will be able to review this webinar. And you can also prepare your questions. There will be a Q&A session at the end of the webinar or also in the middle. And I can say a few words about Online Swedish. We are established since 2020, and that's why doctors love us. Doctors love Online Swedish because we are a child of coronavirus. Yes, and we do offer courses from a beginner's level all the way to C1 level. We also offer Swedish medical Swedish course. Our certificate is recognized by Socialstyrelsen, in case that might be interesting for you. And we also offer Swedish Conversation Club online. It's a language cafe where you can come and practice your Swedish regardless where you are studying Swedish language. So that's a great opportunity. And I can also make this bold statement that we are biggest Swedish language community online, indeed. So please feel free to join us. And also, guys, in case you want to take contact with me, this is my email in case you need to ask something. Otherwise, we'll also have our homepage if you have course-related questions. And for those who have a non-EU profile and non-EU healthcare profile, and you're going to eventually take this Kunskapsprovet theoretical test. Our former student, Dr. Rami, who is, by the way, already working in Sweden, he and his fellow doctor friends, they have established courses which will prepare and guide you through Kunskapsprovet. We have many of our former students who have taken their courses. They are very satisfied, very affordable. So in case you have questions, you can contact Dr. Rami, go to kunskapsonline.org, or also if you go to our webinar part number 1, there you can actually see more in-depth information when Dr. Rami was present and telling all of these things. And guys, normally, there's a saying that doctors recommend, doctors advise, right? That's a common thing when doctors advise. And please, as a person who's been working with doctors the past 6 years, I can tell you advice, actually. Networking is very important. We have many doctors here who can confirm that. And lots of doctors, when they get their position, their job, they feel like, okay, I don't need anyone anymore. I'm done. But it is not truth, because things can change, right? One day you may need to move out. It can be tough with your management. It can be maybe other things that you want to simply change the town, right? Maybe you don't want to be stuck into a certain place for all your life. So that's why it is important that you guys network from the beginning, have contacts, and this helps actually to find also jobs. And the ecosystem of healthcare industry in Sweden is not that huge. I can tell you that If my student will start, work at some hospital, there is a 50% of chance that he or she will meet our former student. There are always, they meet. And here we have Dr. Nader, who is waving and confirming that. And I can say, Dr. Nader, yes, wherever he's going, he's meeting actually our students. It doesn't matter where in Sweden. And that is why, guys, it is important from the beginning, especially when you have already this possibility, right? We are doing these webinars, you are in the classes, you are in this Spro Cafe, right? You get to know each other. So keep contact from the very beginning. Don't save it to the day when you're going to need that person, right? You're going to ask, Robert, can you give me that person's contact? I need to ask things, right? Of course, I will kind of help you with that, but networking, this is something you need to establish. So that is my kind of advice to our doctors, aspiring doctors. Yes. And enough of that. There is a Facebook group, as said, you can join. We will also post this link in the chat so you can join. I would like to guys present you our Dr. Ilze, and Dr. Ilze is one of our former students, and Dr. Ilze has her alma mater is Riga University, Stradins University, or Riga Stradina University, and which also implies that Dr. Ilze had EU pathway. But overall, it doesn't matter at the moment because today we're going to speak about Vårdcentralen, but it's maybe good to something keep in mind. With that said, if there is nobody who's protesting, yes, once more, guys, I would like you guys to turn your cameras on so we can have a humanly possible webinar. I'll give the word to Dr. Ilze. And Dr. Ilze, varsågod.
Hey, my name is Ilze. I'm coming from Latvia. I was educated, like Robert said, in the Stradins University. And I one day decided that I'm going to move to Sweden. I didn't have any plan. So I just moved. Like 4 years ago, I think, approximately. It was very, very hard to find any job, to learn the languages. Started from the bottom, I would say. And then I worked in the plastic surgery and hair transplant clinic for 2 years, like on the sjuksköterska och läkare assistant. And then I found online Swedish, what I was very, very happy about. We have had a lot of wonderful courses, got my certificate, and then sent it to Socialstyrelsen. Waited a little bit, got my legitimation. And then it took me approximately 9 to 10 months to find a job in the Stockholm because I really wanted to stay. So right now I am working in the Vårdcentral Tumba as a legitimerad läkare. And I started in October last year because it was newly opened Vårdcentralen. We started very slowly. It was like my first real doctor job in Sweden. And now we're getting more and more patients, and it's quite lovely there. It's very beautiful. It's new. We don't really have that many patients. We started like for 1 to 2, and then we go up to 4, 5, 7, 8. We use a lot of interesting technologies. For example, we're using artificial intelligence program called LeapScribe. When, for example, if you have a patient, you have a consultation, you just put this program on the background, and it automatically not like corrects, but listens to your conversation, and then it transfers all the information to the program that we use, the TakeCare, the system. So it really, really helps. You don't have to dictate anything. You have to, of course, you have to go through all the stuff that it had listened to, a little bit correction, but it really, really helps. So all the notes are ready just like this. It's great, it's lovely, but it's very hard because a lot of different people are coming from different countries, different backgrounds. I had the patients from like 6 months old to 95. I also, and ansvarig läkare for hemsjukvård. So I have all the patients that are very, very sick, and I go to them with my colleagues and take care of them. I have to go through that. And that's something about it.
What is the best way to prepare oneself before joining? What are they looking for interviews for Vårdcentral job? What is the role of Vårdcentral in the healthcare system? Because it seems different than the rest of the world. Would you say it's good start in Sweden, even if someone wants to move to a hospital job or a different specialty later on? What are the pros and cons? What is the range of salary level one must accept for their job as an underläkare in Vårdcentral? What is fair to ask in terms of salary? Who usually look after the education aspect for us doctors in Vårdcentral system? Are there any exam assessments? How is it for like underläkare? What are the responsibilities for underläkare? That's overall.
I got the questions. I will try to answer everything. But because I worked in the Vårdcentralen for like a few months, maybe I won't be able to absolutely answer everything, but it's just my personal experience. Well, before you join the Vårdcentral, it's very important that you have to understand it's not going to be a hospital. It's not that fast. It's going to be a little bit more, I would say, like chill job at the beginning, because in the hospital, because I worked also in the intensive care unit for the kids, so it's completely different world, Vårdcentral and work in the hospital. Well, how you have to prepare? Of course, you have to be prepared for the interview like any other interviews. You have to be smiley, you have to be a good person, and try to present yourself in the best way. It's be very good, I think, to explain your current situation, because maybe if you haven't worked like me in the Vårdcentral, you have to tell them you haven't worked, so they know what they're gonna into. Because I told my current arbetsgivare everything, and they were like, okay, we understand you are done that experience, so we'll start very slowly. So it's better not to lie. I had, I think, 3 or 4 interviews to the Vårdcentralen, but almost everyone was looking forward to you having some experience and experience in the take care system. But there's nothing you can do about it if you don't have it. So just prepare the questions, prepare answers, be confident. All my interviews were very long, actually, more than an hour for these positions. So try to not to be too nervous. Maybe take some calming tea or something like that. What they're looking in the interviews in the Vårdcentralen. Well, they're just looking for a good person, actually, because I got in my job only because of they liked me. That's all. They just really, really liked me. I asked my chef, the one that I have, why did you choose me? Because I know there was a lot of people with more experience, what I heard. They said they just really liked me. So you have to keep going, and someone definitely will gonna like you. Because there are so many different people and so many different Vårdcentral, and so just have to keep going. It took me 9 months to find a job in Stockholm. Vårdcentral and the healthcare system. I think it's very important, Vårdcentralen, because it's the first step, is the first place where you meet the patients, and there's a lot of sick people in Sweden. They have very good system. When you first talk to sjuksköterska, and she decides if you need to meet the doctor, and that after that the doctor decides where to send you. So it's very different from Latvia, because in Latvia it's very easy to meet a doctor. You get your 5-10 minutes, and usually you get anything you want. For example, in Latvia, you just ask, oh, I want that, and doctor writes it to you because they don't have time. In Sweden, they usually have a little bit more time, hopefully, but at least at my Vårdcentral, we have a lot of time for people, and we listen to them and we try to help and help the best way. But sometimes maybe not to do every possible test or every possible the shocking, because sometimes it's not necessary, because there's a lot of private Vårdcentrals and they also are counting money. Everything where you send people and take any tests, they're counting the money. So you have to keep that in mind too. One day they can come to you and say, "What did you send here?" You have to be very precise in that. I think Vårdcentralen would be a very good start for anyone, even though if you want to move to the hospital after. It's a very calm job, I would say. You have time from 8 to 5, and that's it. Of course, you can stay a little bit longer if you want to, but usually it's to 8 to 5. It has we had a lot of pauses, for example. We have 2 fikas, like in the morning and at 3 o'clock. That's very, very nice when you can communicate with your colleagues. We have, of course, 1 hour break for the lunch. And we don't really have that many patients. You also have time to admin stuff, just to check all your notes and send all the remisses. So it's very good system, but it very depends on the Vårdcentralen. Some of them are not that nice. For example, my colleague, he worked in the Karlskrona, I think, for like 6 months before, and he said it was hell on earth. So really, really, really depends. But it's a good start for anyone because you meet so many different people and so many different diseases, and it's very interesting. It's never boring. Also, we get to do quite a lot of surgeries. Not at mine, we just started a little bit, but there's a lot of possibilities to work with your hands if you like that and meet the people. But it's a good start for anyone to work a little bit at Vårdcentral and understand the system, and then maybe move to the hospital if it's more like this. The salary loan. So I think in the Stockholm region, it's like for example, for legitimerad läkare, it's starting at 45,000 crowns, I think, something like that, 45, 50, 42. But my plan was to ask as little money as I can. So I would show them that I'm interested more in the experience. So I asked quite not a lot. So it might be one of the like tactics when you are in the interviews. That was mine. And I think one of the last one, they also like, okay, she's not asking that much money. Maybe we can take her. I didn't ask for like 45,000, or I asked like less than 40. So you can think about that. But I think like 40,000. 40, 39, 40, 42, 43, something like that. And after that, if you get better, and better, of course, the loan goes up. So it's pretty decent, I would say. Education. Well, all my interviews, they're very important. Of course, you need to have a legitimation, you need to finish the university, but a lot of my interviews, your social skills and how you talk and how you joke and how you smile, I think it was more important because Swedish people, they really, for Swedish people, I think it's important to have a good vibe with their colleagues. You can be the most wonderful, the most knowledgeable doctor in the world, but for Sweden, it's very important to have good connections with your colleagues. If you don't have good connections, relationships, they will throw you out. Exactly. Also, it's very important with the patients too. Maybe you're not the smartest in the room, but if you're very nice and very respectful, your patient's gonna love you. So I think that's also very important. Also, in my job, all my chefs are saying the most important thing is how you behave yourself. You cannot be like, "Hi, doctor." So in Sweden, it's also, well, from my short experience, I would say. Responsibilities. Well, I work as a legitimerad läkare, and my responsibilities is to have consultations with the patients, like kids and adults and everyone. And then after that, I do my assessment and we decide what do they need. Maybe some tests, maybe some undersökning, maybe some magnetröntgen or stuff like that. Or of course, I do a lot of remisses to the wonderful specialists out there who are like the stars that you cannot reach. And usually it's very important how you write all that stuff, because there's a wonderful website called VISS.se. And on that website, it's written everything: when you have to send the remiss, how you have to send the remiss, like referral to the doctors. And it's very important to follow it. As you follow it, everything's going to be great and lovely. If you don't follow it, then you will get your referral back with the words, approximately, "you are an idiot," and never write us again. But it's a good learning experience. So something like that. But I love my job. I absolutely, how you say, thrives. And I love my patients and people that I meet. Also I have Dr. Hanna. She's a specialist läkare. And if I have any questions, of course, I can go to her and ask all the questions. And so it's very great to work at the Vårdcentral, because you also have a lot of websites, you have a lot of books, you have a doctor that's helped you. So it's not that crazy and hard. And yeah, just have to keep learning, have to read a lot, and something like that.
Sorry, Dr. Ilze, what was the name of the homepage you mentioned?
VISS. VISS.
VISP, with P in the end, right?
VISS. VISS, like everything.
Okay. No worries.
I will write it a little bit. And it's like the Bible, I would say. VISS.no. So it's very helpful for a new doctor like me. For example, I don't know what to do, but on that web page, it says, okay, do these tests, do that Rongen, and then do that if you don't know what to do. And also what kind of medicine you have to prescribe, all the antibiotics and stuff like that.
Dr. Rita has written, do doctors get an adaptation introduction period when starting work at Vårdcentral?
Yes, absolutely. On my interviews, we talked about that too. I said I would really like to learn that TakeCare system that everyone was talking about, because I had absolutely no experience. So my chef, he fixed like a 2 weeks introduction, 2 weeks of introduction in a different kind of Vårdcentralen. And then I went through everything with them. I went with the sjuksköterskor and the sköterskor, how all the process is going, because it's like my first time working the Vårdcentralen. Explained all the system. I was sitting with the doctors. They showed me all the system, how it works, how it does. So it was very lovely first 2 weeks. So you are not just put on the consultations with the patients going on. So it's very, very, very great. And after that, they were very understanding, and they started with 1 patient, and they asked me, if you're feeling okay, maybe we can start like 2, maybe after that you can take kids. So it was very slowly, lovely, but it was at my Washington. Yeah, you usually get introduction. Yes, first 2 weeks, sometimes 3. Something like that.
Oh, I've written in the chat, Ilze, how confident were you with your conversation Swedish skills when you applied? Like personally, it's holding me back, and I think I need to work more and more before I get the courage to actually apply.
Well, before this, I worked in the hair transplant and plastic surgery clinic. I still think my Swedish, unfortunately, is lacking, and there's much more to learn. But the conversation in Swedish I had pretty good, because I had a lot of patients in the clinic that I worked before. But during the interviews, everyone always was very, very nice. If you can answer the questions, even if this with the simple Swedish, if you're just trying to smile and they were all extremely nice. Really, every like 4 interviews that I had. So it's better not to think that much of your Swedish skills. It's better to think just to prepare the answer for the most typical questions that they're gonna ask, because they're usually the same. Every single. What are your salary expectation? What are your personality traits and stuff like that. So you just can prepare a little bit. I think it's gonna be okay. But no one corrected any Swedish. They were all nice. They were complimenting. Oh, your Swedish is so good, so wonderful. Usually they are all lovely, lovely people. So all the interviews were nice. So don't really think that much about it. But it's nice to prepare. It's nice to prepare before. Just look for the all typical question. Yeah.
I can
Cool,
also
thanks.
say very fun story with Dr. Ilze when it was in Språkcafé conversation sessions. Once Dr. Ilze said, you know, Robert, I met an awesome girl from Portugal in Språkcafé. I said, yeah, what's her name? Yeah, that was the Dr. Teresa. The funny part was that Dr. Teresa was going to the same class as Dr. Ilze, and they got to know each other.
Well,
Yeah.
that's true.
Yeah. Precis. Let's see. Dr. Shweta had a question, please. Dr. Shweta, go ahead.
Yeah, I just wanted to ask, I'm currently a medical student in the EU, and I'm graduating in about 2 years, and I'm trying to figure out where to apply for AT. And I want to ask, is Vårdcentral a good spot to maybe start? Yeah, are they?
I think AT is only for the Swedish folk, people who are outside. Well, I'm sorry, where are you studying?
I'm studying in Poland, so I will have an EU degree, but I'm figuring out if I want to do my license before I apply to Sweden, or if I would like to get my licensing done in Sweden. So I'm trying to see where.
You will have to get your answer. Oh, I think Nader, Dr. Nader want to answer. I think for the outside it's BAT, not AT. There is a very similar thing, and there's also called like BAT integrated. So, for example, at my Vårdcentral, they said that maybe I will be able to do my BAT at the Vårdcentral. But yeah, you'll have to get the legitimation first after you finish the university. But AT, I think it's only for Swedish students. The study in Sweden, they have to do it.
There is some. So there's some reform.
I can add something. If
yes,
that's
Nader.
Okay.
Of course.
Yes, of course.
Yes. So let me just. I'm going to come back to introducing myself later. But
Dr. Nader does not need an introduction. He is. Everybody knows Dr. Nader, of course.
I hope so, at least. Well, I studied myself in Poland, and then I moved to Sweden for 2 years ago, and worked in Uppsala, and then now in Göteborg I'm doing BT, and then I'm going back to Uppsala next week. Anyways, so to answer your question, in general, the general rule is like this: most people that study in Europe don't need to do AT because they get their license immediately. However, there are 9 countries in Europe that do not give licenses immediately after, and Poland is one of them. There are 2 ways to do it, to go after you graduate from medical exam from Poland, for example. The first way is that you try to get an AT somewhere in Sweden. And it works for some people. It worked, and they did the 18 months or 21 months of AT, and then they get their license in Sweden. The other way, which the way I did it at least, is that I did that stage, and I got my license in Poland, and then I moved to Sweden. I worked a little bit, and then I did BT. In total number of years, it's quite the same. The idea is how easy it is. Yeah, how easy it is to get AT or BT. Both of them are not that easy, neither that hard if you're willing to move around at least. The only thing that is more difficult with AT is that there's a lot of people. It's the Swedish graduates so far, plus people from Poland, people from Portugal, for example, and there were other 9 countries. I talked about it in the first seminar. So there is no right or wrong. My recommendation for people that are not Swedish and they study in Poland is to get the license first. But there is no right or wrong here, as I wanted to say. And there is English stage, by the way, for people studying in Poland. So you do an English 6 months internship and get your license. Yes.
Okay, sorry, I have two follow-up questions. When after you did stage, you said you moved to Sweden. What did you work as?
I worked as a licensed. First, I waited for my license for around 6 months, but I worked during the time as a junior doctor, underläkare, in
Okay,
vascular
okay.
surgery, Uppsala. And then I got my license. I continued for another 6 months there. Then I got BT in Göteborg, in Sahlgrenska. I've been now 1 year in Göteborg doing BT. And next week I finish and I go back to Uppsala to work as licensed doctor until I get some specialty, probably residency, hopefully.
Okay. All right. Sorry. Second question. I'm not an EU resident. I don't have an EU passport. Does that make things harder? I presume so.
I'm such a person too. I'm not an EU resident either, and I
Okay.
don't have an EU passport. It makes things harder. That's the answer. Yeah, but it's not impossible.
Okay.
There is a
Okay.
there is a
All
lot
right.
of ease. There's
And-
more. It's much easier nowadays than it used to be a few years ago because with all this new immigration laws, they are more targeted to get doctors and the highly educated people into the country. So I would say you need
Okay.
just someone that is willing to fix the paperwork for you.
Okay. Apart from like your interview itself, would you say there's anything specific that they look forward to, like, good grades or research or anything like that? That they're
Depends
looking
what you
for on
want to
your
do.
CV?
What do you want to do? What are you
Okay.
thinking? What are you thinking to do?
In terms of specialty, I'm thinking about surgery,
Mhm.
more specifically pediatrics, but yeah.
Mm. Yeah. Well, it's gonna take it. It needs a lot of work. I would not say that it would be easy, but it really needs contacts. That's how.
Okay.
If you want to get in, you need to work in that place before you can get the residency. That's how it works in Sweden. No one gets residency without working in the place. Almost no one gets residency. Most of the people, there's some exceptions, but most of the people work in that place. They apply for a vicariat, so they're like a underläkare job, a junior doctor or something. They work there, and then they wait until there is a place for residency, and they apply. But that's what I mean about contact. It's working in a place. That's what you need. For surgery, you will really need to be movable. Like you would be open to moving around because big cities is almost difficult to get, but smaller cities is much easier. They don't look at grades.
Okay.
They don't care about other like things that you do more than research and like academic work.
Thank you so much. Thank you so much, Dr. Ilze, for just sharing your story and allowing us to know that it's actually possible. So same as Shweta, I'm also a non-EU resident as well. And when I'll be applying to Sweden or to go to Sweden, I suppose once I have finished my internship, so I'll be a licensed doctor. And from my understanding, from the last webinar that we had, the underläkare position is only available for people who are not licensed doctors yet. So is there any other job that I can just apply for that will allow me to, I suppose, gain a little bit of experience within the Swedish system before writing the exam? So I think that's the question that I have.
I just want to say that underläkare, that is for even licensed people. You can apply to underläkare jobs as licensed doctor.
Okay.
Underläkare in Sweden, the concept underläkare is anyone that is not a specialist. So even a resident is called ST underläkare, basically.
Okay.
But so you can apply to all of these jobs. It's not, and that is the thing that's the only thing that is a real doctor job before you get a specialty, kind of.
Okay, all right. So prior to even writing the Kunskapsprovet, I can just apply for that and then gain a little bit of experience and then write the exam.
Sorry, what did you say?
Oh, I was just asking, I just want something that will allow me to go to Sweden just to gain some experience and to be surrounded by people who speak the language as well, because currently I'm learning Swedish away from, like I'm in Africa right now. So I just wanted to know what options I have after completing my internship and becoming a licensed doctor. And also me writing the exam. So that gap period, how can I then go to Sweden, and what are the jobs that I can work as while I improve my Swedish and prepare for the theory exam?
Uh-huh. Okay. There are positions like I don't know exactly how it is with the Kunskapsprovet. You need to ask one of the people that did it. I'm not 100% sure if you can work as underläkare if you've not done the theoretical deal of Kunskapsprovet in first place. I have that's not the path that I took, so I don't have I have limited information around it. But sorry, but there is a läkare assistant job as well, which is kind of a job where you work as a doctor, but you don't have the full privilege as a doctor. You cannot like write prescriptions or take decisions by yourself or so on. You need to always consult. But it's a really good way to start it as an introduction. Another thing that you can do if you're okay with not working in the sense of getting money, you can email different clinics and see if you can go and do a practice there. So just go around, see how it works, how the system is. That's how I got. That's what I did before I moved to Sweden. Also, just go around like a month or 2 months, just learn, try to talk to patients, try to see how the system works. A lot of clinics, if you're already in Sweden, a lot of clinics will be okay with it. It might need a lot of like emailing here and there, but you will surely get one at the end.
So for underläkare, I would need to have at least the theory exam, not necessarily
I am not sure.
the practical, but the theory.
I'm not 100% sure. I'm sorry, but I cannot answer that with certainty. But
okay, all right.
But that's at least that's what I have in mind. But I'm not 100% sure.
Let's see if Dr. Ahmad wanted to add something to it, or it was another question.
It was a question, but in general, if I add something, it's very hard for you to get a visa to Sweden as an underläkare who is ahead of doing this theoretical exam. I'm like, no clinic would want to do that because it is a journey. It is 2-3 years plus journey. So even as läkare assistant, you highly likely won't get that job if you're outside EU and didn't even do the theoretical or practical exams.
Okay, I have a question to Nader because I'm Polish. I also study in Poland, but my partner is Swedish, and I wanted to ask you, how hard is it to actually get a OT with some context, let's say, and if it's better for me to actually do an OT in Sweden or the 12-month stage in Poland?
Yeah, it's a really good question. My partner also studied in Poland. She's Swedish, and my fiance she did the AT way. I did the license and BT way. So it worked for both of us at the end of the day. The thing is, AT it's kind of, I cannot answer that question with certainty as well. But it's easy. It's not hard to get AT if you're willing to move around. If you want to do it in a small village on the borders of Norway, for example, you can get AT immediately. I know from Poland, from my colleagues, the Swedish colleagues that were in Poland, there is like 5 to 10 people get AT each year immediately after they graduate. So it's not impossible. Some people work a year before they get ATE, and then they get ATE. So it's not impossible, I would say. For you, is it better to do ATE or the Swedish stage or the Polish stage, 12 months? It's a difficult question. It depends on how good you can compete with the people applying at ATE. Usually the people that are the Swedish people that know the system already, the people that are more that like are better even with the language, they have higher chances to get it. ATE, we're talking about ATE. BTF so far up to next year, end of 2027, it's kind of exclusive for people that are already licensed either through the Kunskapsprovet or through licensing in Europe. So they're much easier with the other with language, for example. They're much easier with accepting people to BT because they're trying to spread it out, to spread the concept out. So far, I personally would recommend that you do stage and then do BT. It's gonna end up with 2 years, which is the same as ATE, but you can also try to apply meanwhile for ATE and see if you get one. And with time, they're going to close ATE. From beginning of next year, or maybe 2 years ahead, they will start to downsize ATE because they are trying to replace it with BT. I hope I answered your question at least.
Yes.
Thank you, because I'm going to graduate next year and I'm just wondering, like how to do it properly, because, like 12 months stage also requires me to stay in Poland, like away from my partner, which is also pretty difficult for us. And that's why I'm just asking and just
completely understand. You can try applying for ATE from the beginning and see if you get it. But I would say it's better for you not to put energy on like doing a vicariat, or you work as underläkare 1 or 2 years before you get to ATE, because by the time you will be done with that, there is a high chance that ATE positions are getting just lower and lower.
Hello, good evening, everyone. My name is Adiola. Although I'm not a doctor, but being here, I've learned a lot. So I'm studying nursing. I am in Poland. I'm studying nursing in Poland in English, and I'd really love to move to Sweden. So your information has been very helpful as doctors, but I was hoping that if I could meet someone, so maybe through Robert or any of the doctors here, who could introduce me to a nurse who is working in Sweden or has lived in Sweden and has much more experience, because I've read a lot about how I need to work as a nurse in Sweden, but then nothing beats the practical knowledge that will be shared one-on-one. So if there's someone that can introduce me to a nurse who has years of experience working in Sweden or moved to Sweden, migrated to Sweden from somewhere else in Europe or outside Europe, it would be very, very helpful. So that's my request. Thank you.
Do you have a European passport?
Do I have a European passport? No, I don't. So I have a master's in public health. I moved to Sweden in 2024 on a job seeker visa. And then when I realized that it wasn't easy for me to get a job in public health without the Swedish language, and the fact that nurses are in shortage, and I've always wanted to have some clinical knowledge and experience, I thought it might be a good idea to actually go study nursing. So I don't have a new passport. I'm a Nigerian. But then by the time I'll be going back, hopefully I would be graduating with my bachelor's in nursing and my master's in public health.
Okay. Okay. I will try to. You can contact me on Messenger, and I'll try to talk to someone that I know at least.
Thank you. Thank you so much. Thank you.
Regarding random läkare who come like in their BT, AT, and things like that, what is mostly expected from them after a while, or how are they treated? Have you had any of them in your clinic in Vårdcentral?
I'm sorry,
I understand you Vårdcentral have have a completely different system than the hospital, and they're expected to basically learn it very quickly, or
Jo. You mean, did I have any utbildning in the Vårdcentralen?
like utbildningstjänst, the people who are doing BT, AT, do they come to the Vårdcentral you work at, or
No,
not?
not yet. Not yet. We opened just like 4 months ago. So it's like a
Okay.
plan. When we get more patients that are in the Vårdcentralen, then we will maybe have like a BT integrated. But it sounds a little bit like a big dream, so I probably will not follow that, because it will take like a few years for them to build so many patients. So I will work a little bit, get a bit experience, and then I will try to seek for the BT in the Stockholm or Uppsala or somewhere else. Yeah.
Okay.
So they said it to me that they can do it probably, but probably it will take like a few years or something like that
Okay.
for the BT to be integrated in the Vårdcentral.
I meant the basically the doctors who come to the Vårdcentral to do the Vårdcentral part of BT.
Yeah.
That's what I was
Yeah.
asking about.
That's true. Yeah, that's. But we didn't have any right now. We have only 3 doctors in my Vårdcentralen right now, because it's.
I'm doing my. Oh, sorry. Go ahead.
So my question about the system, it's a completely different system from what I understand on the Vårdcentral. Are you expected to learn it in a week, or expected to do
I'm doing now. I'm in the last week of my Vårdcentral placement in BT, and this is my last week of my BT also. So it really depends a lot on the Vårdcentral that you're gonna get when you get BT or AT or whatever. But in general, the expectations are you're not expected to learn the system in a day and night. You're expected to develop during that time. In AT, in BT, it's around 4 months that you get in Vårdcentral. In AT, it's 6 months. And you're expected to start slowly, meet few patients, learn the system, learn how it's working. You always have a handledare, you always have someone that is a reference person to you. And if you're going to be doing BT, then you have a lot of sit-ins that you do also during your BT, around 4 to 5 sit-ins each placering. That sit like you're being evaluated with in a sit-in. That's what a sit-in is. Then they will see exactly how you're developing. The expectations are not that you should be able to do the system from day one. No, they know that this is the first time. You just go, be honest with them. This is the first time I'm in a Vårdcentral. I've worked a lot in the hospital. I myself did that. I haven't worked in Vårdcentral before. I worked 1 year and a half in hospitals, and then directly to the Vårdcentral. And then so slowly you start learning, you start asking, you start going, and then it goes on. 3rd, 4th, 5th week, you will start seeing that it starts to get up. And each case that you get in the Vårdcentral, when you solve it out, this case is gonna repeat one day during the replacement. You don't need to ask about it that day, and so on. So you learn on the spot, basically.
Okay, thank you.
Dr. Nader, if you could please briefly just talk about BT in general, like how many months do you spend in which department, and if during different departments you move in different cities, or is it all in one place? Just briefly about that.
That was the purpose I came to that to that webinar, basically. Well, okay, so BT itself is it's new in Sweden. It's supposed to be a part of your new ST. In general, there's two forms of beta. There's the integrated one, and there's the fristående or separate beta. The integrated one is the one that you do through your arbetsgivare, so the person that actually provides the job for you. In practice, integrated beta is in psychiatry and primary care, so Vårdcentral. That's in practice where you can get integrated beta. In theory, everyone can give you that, but that doesn't happen. The separate beta is regional, so it's the region itself that organizes that, and it differs a lot between regions. There is no real organized structure of how beta should look like at all in all of Sweden. There is 18 how do you call them, delmål. There's 18 points that you should achieve during your beta, but how you achieve them is totally up to the region itself. But the most common beta, I would say, is that 12 months beta, with psychiatry around 2 months, 2 months and a half, emergency around 4 months, and Vårdcentral around 4 months. Then in that emergency part, there is a lot of that change, for example, that put medicine, internal medicine, and surgery. There is some regions that makes it open. You can choose where you want to be. There is some regions that makes it obligatory that you are 2 weeks in 1 month in geriatrics, for example. It differs a lot there. But in general, the three big parts of BT is psychiatry, emergency medicine, or emergency placement, so anything that can drive emergency, and primary care, and that is Vårdcentral. I did my BT, and I'm doing my BT in Sahlgrenska in Göteborg. In Sahlgrenska, the way they organize the BT is that you get 1 month of introduction at the beginning, where you do simulations, you do so CPR training, all of that, and then you get. I got my first placement was psychiatry for around 10 weeks. Then I went to emergency medicine, and in emergency medicine, I'm more surgical oriented. So they put me in vascular surgery, which is what I want, and general surgery. And I also worked in the surgical emergency during these 4 months. So I had like a shifting between these things. And then at the end, I went to the Vårdcentral. And in Göteborg, they're quite nice, so they put you to the closest Vårdcentral to where you live. And now it's been good. It's been going well. And then when you're done, you have an external bedövning. You have an external doctor that comes and interviews you about your BT. What you try to do, at least in Sahlgrenska, what you should do is to try to motivate how did you go through these all 18 points, and how did you achieve them to be a doctor. You get a lot of education under the time, at least in VGR in Göteborg. You get a lot of courses, you get a lot of time, you get a lot of help from the BT organization. So in general, I'm really satisfied with it, and I would say that it's something really good. But usually 12 months, three placements. That's how it is.
Dr. Ilze had prepared for us 5 words that Dr. Ilze finds very frequent. Of course, we will also ask Dr. Nader, but so far, Dr. Ilze, can you please tell us 5 words to start with? And if you have any bonus words, please go ahead. Word number 1 that Dr. Ilze has nominated, it is bedövning. Bedövning. And the doctors, what is bedövning? Silence. Silence, yes. Anesthesia, right? Anesthesia, bedövning. And word number 2 that Dr. Ilze has nominated, the word that we've been hearing a lot in our newly initiated medical Swedish course, that was remiss. And remiss.
Referral.
Referral. Jajamän. And word number 3, it is, I guess it's a name, a LeapScribe. That I think Dr. Ilze already mentioned. Dr. Ilze, can you
It's getting very popular, by the way. It's not only my Vårdcentral. A lot of Vårdcentral is starting to use some kind of artificial intelligent stuff. So the future is here.
The future is here. And so Dr. Ilze, LeapScribe is basically artificial, so AI note taker, which can take notes in different languages. I think you mentioned it can also take English and Russian as well as a bonus.
It translates directly in Swedish.
Okay. So this is for you to use for a journal, right? That's how you. It is going to transcribe the text for the journal, or?
Yeah. It's just takes all the information. For example, we've been talking for an hour. It takes the most important stuff and puts it in the journal. For example, actual, like what problems patient have, and what his symptoms, what he wants, and what you're gonna do, and it puts in the beautiful, like, concentrated languages. It's not like a block of text, so it's very useful. But it's very nice to get through that after that, to delete all the useless stuff. Sometimes it tells about the sisters and the mothers and what his cat ate in the morning, something like that.
That is very important information indeed.
It's learning. It's learning. It's getting better and better at LipScribe, but it's very good. It's very good.
And then we have here word number 4. Unfortunately, Dr. Evdoxia is not here. Actually, it's her favorite word too. That is utslag. Utslag. Yes. Yes, Dr. Mimasa, remember utslag? That's also one of her favorite. Once upon a time. Rashes. Yes. Utslag.
So many rashes you get in Vårdcentral.
Yeah. Okay.
So many, and they all look same.
So, Dr. Ilze, is it before or after the visit to the Vårdcentral?
After, of course.
After the visit.
After they meet me, they get all the rashes.
And the word number 5 Dr. Ilze has nominated is anamnes. Yeah, anamnes, I guess it's not Swedish word as it sounds, right? It's this history. So these are the 5 words, Dr. Ilze. Dr. Ilze, are there any bonus words that you hear that kind of something that you use frequently apart from these words?
Something every doctor is afraid of. Anmälan, maybe.
Anmälan. Oi. Report. If somebody reports doctors.
Yeah, okay. That's not great. Everyone is afraid of that.
Okay. Yeah, I mean it's hard, right, to be doctor in Sweden when they kind of what can I say? The relationship between doctor and patients is how can I say? It tends due to this anmälan report. So as soon as, for example, they don't like something, they can say, "Yeah, I don't like this doctor," and it seems like that could be misused in some way. I don't know. Yes.
Yeah, it's very easy to get reported.
You will figure out soon, guys, if it's true or not.
But not a lot of it becomes a big deal, I would say. It's just the power that exists, but not a lot of it becomes a big deal.
Yes.
Usually,
exactly.
I mean, all of the chefs, all of the big doctors, they all have gotten anmälan.
Okay, so it's not that serious. Okay, good to know. That is good to know.
Yeah, it's a good to know. I mean, like, you don't need to be scared. You need to do your job as a doctor. You don't have to be scared. The only thing, you need to be respectful to the patient. The patient needs to feel that they're safe.
Of course.
That's it.
question to both of you, Dr. Ilze and Dr. Nader. What journal system do you use, Dr. Ilze? What is the journal system
We
in
are using TakeCare. I think there's also Cosmic, but I don't know anything about that. But we use TakeCare.
TakeCare? Och,
Yeah.
absolut. Och, Dr. Nader, which one do you use in your region?
Well, I've worked with a lot right now. I worked in Uppsala. I worked with Cosmic, and then in Göteborg in the hospital Milior, and in primary care and Vårdcentral, it's Asenia, which is basically another version of TakeCare. Yeah. So yeah, these journals. I would say that VGR, Västra Götalandsregion, where Göteborg exists, is not the most updated when it comes to technology, unfortunately.
Is there anything one should think about, consider when it comes to journals, the language? How difficult is it actually in terms of language?
It is very difficult, especially if you have never done it before. It was very hard for me, so I was very thankful for that LipScribe thing because it helped me a lot. But sometimes it doesn't work. Sometimes something happens and you have to write it yourself. And the most important part about the journals, you have to remember that patients, they read everything. Every single word that you write is available to the patient. And they can call you and say, I completely disagree with what you have wrote and you have to change it. And that can affect you quite a lot. So it's better not to use, like for courtnings, to not write court. For example, in Vårdcentral, we are not allowed anymore. So you have to be precise and you have to be very careful what you write, because patients, they know everything and they read everything and they can be very mad when they don't agree with you.
So they may suddenly figure out that the doctor has prescribed Lavemang for no reason.
Yeah, sometimes you like mistake something. You think that maybe this patient has this. Especially hard, for example, with the opioid users, the patients. It's like clearly he's a opioid user and he demands opioids, and you say nay. And you write it in a journal trying to be like respectful. You like, I think that this patient might be something, and that patient calls you and tells you that he will set the Vårdcentral on fire if you do not delete that message, that sentence, because they think that you are lying and that they don't want it to be in Vårdcentral. And usually the way is that you delete it. That's what my handler, she said, just delete it. Just don't get into that.
Well, I'm happy that we are online. So, yeah, tack så mycket. Och Dr. Nader, what is your experience about journals?
I would say that it is challenging. Starting in hospitals is much easier, just to be honest. Because I would say, not easier in the terms of work, but it's easier in the terms of the journals only. And it's basically because in hospitals you don't have you have like some sort of structure. You have the inskrivning when the patient comes, the epicris when the patient goes home, and then the daily notes. And there you're more free to write. Patients don't understand everything you write there because you're writing a lot of medical stuff, and they're not interested to know. They're interested to know what happened to them when they came and what happened to them when they went home. They're not interested to know how they developed during the day, except some patients maybe. In the Vårdcentral, it's another deal. It's exactly like Ilse said. They read a lot, they disagree a lot, and they demand a lot, patients. Especially she lifted a very good example, which is like opioid overdose or opioid overuse. These patients, they do not agree that they are opioid overusers, for example, and they don't like, or alcohol problems as well. These patients are quite difficult to write or to contact with about this thing. And they are afraid always that this thing is going to stigmatize them and that everyone will look at them in that way as well. So, and Yeah, using the journals can be challenging if your language is at the beginning, it can be really challenging. But I think that you learn a lot with the mistakes that you do, and you learn a lot from other people's notes as well. When you meet the patients, just read what the other persons wrote. How did they do it? I personally use a lot of AI as well to formulate me in a better way. Without patient-sensitive data, of course, that's not allowed. But you use like you write the gist itself in your own Swedish way, and then you put it in AI and ChatGPT or something like that, and see if it becomes much clearer also. That's okay, I guess, as long as you don't use patient-sensitive data. No personal numbers, no names, no ages, nothing.
How real is the language barrier? I mean, when you are there, you know, that you start to work. This is a question, I guess, it's in mind of lots of aspiring doctors who is going to work in Sweden. During these years, I see different approaches, and sometimes I have this sense that there are some people who think that they would easily manage the work right after 3 months of learning Swedish. And in reality, how harsh is that reality in terms of, you know, speaking, writing, and understanding real conversations? Yeah, starting with Dr. Ilze and Dr. Nader.
Well, it is hard, especially with the older patients. I think I mentioned that I'm a doctor that is taking care of the older multi-hook patients. That's hemhook ward. When you go to the patients at home, you take care of home. They don't not coming to Vårdcentral, and quite a lot of them are like a little bit older Swedish people, Swedes that speak very hard Swedish, and they will know if you don't understand them. They know immediately. So, but it's very nice to work at the Vårdcentral because you meet quite a lot of people with a lot of accents and backgrounds and older, and you get in the understanding of Swedish. Maybe not so much, for example, not so much my Swedish personally, but understanding it improves very, 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 very fast because you meet so many different people from older and younger and so many backgrounds. That helps quite a lot. But yeah, if you do not understand your patient, they will know. They're like, oh, do you even understand what I'm saying and stuff like that. But when you are a good listener and you're like, yes, of course, you're just trying to get all the more important information for what they're talking. Of course, sometimes I do not get some words or stuff like that, but I get the most important information. What kind of help do they need? And if you're like an active listener and you're like, yes, of course, I'll help you, it's gonna be okay. But the understanding improves dramatically. So I would say before I understood that maybe like 85, 90%, I would say, but now it goes very up and like everyone. Yeah, but just have to be nice, you know. And
Absolutely.
if you're nice to your patients, they will be very understanding because they feel if you like care and stuff like that. Maybe your Swedish is not perfect, but they think, oh, thank you for listening, doctor. Thank you very much. Just listening, just because you listen to me, I'm so happy. I feel better. So, well, it is like for me.
Yeah, that's a human aspect. Absolutely, absolutely. And Dr. Nader, varsågod.
I agree completely with what Ilse said. The beginning, I've been working now 2 years in a row. I still have some difficulties in some in expressing myself, even in English sometimes. So that thing doesn't disappear easily. But yeah, at the beginning, it's hard to understand. It's hard. The Swedish that you learn in the books and you listen in the courses is really beautiful Swedish and easy Swedish, but the Swedish that people talk sometimes it can be tough. But it, you will not have that big. I would say after a few weeks you will start feeling that you developed just 2-3 weeks ahead, you start feeling that you're much better. A year after, you look back at yourself and you're like, oh my God, now I'm more fluent in Swedish than I'm in English, in medical terms, I would say. And in 2 years now, I'm like, I think it's easier for me to speak medical Swedish than English Swedish right now, than medical English right now, because of working too much with it. So I mean, like that is part of any language, any learning any language. It just gets it's a challenge at the beginning, but then it comes easier. And as Ilse said, be nice with the patients. It doesn't matter how much you're good, as long as they feel safe, they feel listened to, they're gonna like you. And if patients like you, your colleagues will like you, your superiors will like you as well.
And there is one question which popped up in my mind, which is actually a doctor question that will concern the CV. Are there any secrets in CVs that we don't know? Yes, I see that Dr. Sofia got intrigued about that. Yes. And starting with Dr. Ilze, yeah, in case, you know, there are some magic beans.
Artificial intelligence is your friend.
AI,
Like
okay. Ja, varför inte?
It helped me. It helped me a lot, I think, to get my interviews. Yeah, I tried to write my stuff that I decided, okay, I will do, and I put it after that into artificial intelligence, and it wrote it much more eloquent and beautiful, I would say, like that. So, yeah, and I got like 4 interviews, so I think they thought it's okay. I think maybe it's not right to do it. I don't know. I'm not really sure about the aspect of that. But if you have if you have that artificial intelligence to help you, and it can get you interview and it can get you a job, I think you should use it, because it helped me a lot with the letters that I wrote, the CV that I sent, and in the end, it just to get you the interview. In the interview, you will have to show it what you are. So
Absolutely. Yes. And Dr. Ilze, are there something that one should consider even as you said, I mean, AI can improve things, right? But it must have substance to improve. And the question is, this substance, are there some elements that initial that one should think of, right? I mean, any kind of keywords, certainly, because we know that, for example, as the flow of CVs is huge, one cannot go through them manually. I mean, it has to filter, right? There is an AI filter which filters out the CVs. Are there anything in that regard, or some keywords, or some must-have elements in the CVs that we need to all have before we send it?
Oh, I'm not really sure about that.
No worries.
Sorry, I just know that there should be a photo. I've heard from someone.
There should be a photo. Yes, that's correct.
There should be a photo in Sweden, because they like when they see you as a picture. It doesn't matter what you look like. I would say it's morely that they see you like a person, not like a paper. I think it's important in Sweden. It's completely opposite in Latvia, for example. There should not be a photo. So it depends on the country. No, for sure, I'm not sure what should be. If I would knew that, maybe I would get my job a little bit earlier if I knew like a secret code or something like that.
But photo is great to know. I mean, because it's not granted, right? Sometimes you see that people like send email and they have no clue that they're supposed to add the picture there. And Dr. Mimansat, question, please.
Not a question. I just wanted to add about the CV point. I've received some feedback, and I think it was Region VGR, and there the lady was, I guess, the HR person. She literally wrote that I guess a lot of people send in AI generated personal brev, but you should at least try to make it more personal, because it's very much copy paste. Every single person has the same things written in there because it's so generic. So yeah, as you said, like if you're using AI, you should at least try to
just use it as a guide for language, but not the elements of it. Because I guess that it literally showed the frustration of the person in that email, because she was like, oh my God, all the emails are just the same. And at least just try to avoid and try to stand out in that way. And yeah, that's all I wanted
I was
to say.
using more like sentences that it's generated. For example, I read the letter that it generated, and maybe some sentence sounds a little like a good sounding sentence, and then I put it inside. Yes, of course, not like a copy paste. I think everyone knows that. With the artificial intelligence era, just maybe some good sentence that looks good. But yeah, it should be like a mix of yours and I generated text, I think.
My advice with artificial intelligence in general is that feed it, not eat from it. So basically, write what you think, and then send it to artificial intelligence, to ChatGPT or whatever, and let it make it better. Don't change. Don't tell ChatGPT write me a personligt brev, but write your own personligt brev. Send it to ChatGPT. Make it better, and then you will see. Then it will never be the copy paste thing. It will not omit the details that you wrote. And around about tips and tricks, I don't know big ones more than having a picture, but I would say keep it short. Keep your CV short and easy to be read. CVs with a lot of details, right, left, up, down, too much words. These do not attract people. People who are trying to filter out candidates, they're looking at key points. For example, if you're applying to a BT position, they're looking for someone that has a license. They need to see that, oh, this guy is a licensed doctor. They're looking for someone that had experience before. So, okay, here's his experiences. Okay, that person interests us. And they're looking that he lives in Sweden and has a personnummer, usually, for BT at least. So you'll put your address in Sweden, and that is enough. Then maybe they're looking for also research if it's a university hospital or so. And then they will go and read your personligt brev, and then after that they will call it the interview where you actually show what you can, as Ilse said.
And meanwhile, Dr. Nader, which are the 5 words that you will nominate?
Sjukskrivning, number 1.
Sjukskrivning, number 1, yeah.
It basically means, what is the English word for it?
Yeah, that you are in a sick leave, right? That you are in a sick leave.
Yeah. Exactly. See, I told you guys, I forgot English.
Yeah, that's a normal thing. I mean, everyone will go through that. Yes. So sjukskrivning. So somebody got sick and report, right? Like you report.
I would actually agree also with the word remiss. A lot of people, they like the remiss. Röntgen is a good word.
Röntgen, X-ray, absolutely.
A lot. And no, what would be that? Oh, undersökning is also a good word.
Absolutely.
And a lot of like yrsel. Yrsel is a good word.
Or dizziness,
or vertigo.
Yeah.
Vertigo, dizziness.
Precis. Yrsel. Yes. That's common symptoms, right?
That's the most annoying symptom you will ever meet in Vårdcentral.
Yeah, that's the most horrible thing that you can see. Before you meet the patient, if the patient has yrsel, and you have to check everything, because it can be anything.
It can be anything and it can be nothing. That's the thing with it.
Yes, exactly. You have to check first that he is not like intracranial bleeding or something like that.
The differential diagnosis of yrsel is almost everything that is in the book.
Yes, exactly. And usually it's nothing. The best thing is
99%.
if the patient has like very high blood pressure, like 200, and then like, oh, maybe it's that.
TikTok, that's a reason. Instagram. By the way, guys, I have also a question that will be a doctor question. For example, we have here some aspiring doctors who will hopefully start working in summer. And is there anything that you would reconsider, you will do in a different way if you were about to start working? I mean, let's say, now you have some experience, right? You have gained experience, you know things. Is there anything you would do in a different way?
I would take it easy at the beginning. I'll not be so hard on myself because I remember my first month at work. I went to work, came back home, ate a small meal, and slept till the next day. I slept like 10 hours a day. That the first the 10 stressful hours a day, I would say. But take it easy. It's gonna go. It's gonna go fine.
I don't know. I got migraine every day when I started working. I was so stressed. So I got 2 weeks of migraines. I'm not joking. I took so much meds. Yeah, take it easy. It sounds great to do, but it's not possible to do because
Yeah, I know.
there's so much at stake.
This healthcare job doesn't sound very healthy, by the way.
A practical thing to know in Sweden, it's really, really okay and kind of appreciated if you say, I don't know. Even to patients, when you tell them, I don't know what you have, but it doesn't sound like it's something dangerous. That's really appreciated in Sweden. You don't
I
have
will
to
read
know
about it.
everything.
I will ask my professional
Yeah,
colleagues, and I will definitely
yeah,
call you with the answer because I want the best for you. Usually, what I say to my
exactly,
patients, I want the
exactly.
best care for you. That's why we will take a little bit of pause, and I will call you, and we decide what are we going to do next. Because they
Yeah,
see you like a human being too. You're not like that god or something like that. Like you're a team with your patient. Well, at least that's what I want to be. I don't want to say that, oh, you do that, 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 that. Yeah, see, what do you think yourself? What kind of help do you want? I trying. Sometimes patients they know best. They think, I think, oh, maybe I don't need like a medication. I would want to talk to someone. Okay, psychological contact, very easy. No antidepressives. So sometimes it's just ask the patient what they think, what is best for them. Well, that's how
there
I
is
do it.
actually in Vårdcentral, when I did my BT, there is a structure of how you have a consultations with patients in Vårdcentral.
Yeah, that's
It's called consultationsteknik. This is something that all Swedish students learn during their medical practice. We can have just one seminar about how medicine in Sweden differs from medicine in in the rest of Europe when it comes to doing some examinations, when it comes to a structure of the meetings with patients, when it comes to the mentality of the sjukvård, of the hospitals and of the system itself. So it's totally okay to like say this is I don't know, or I can't do this. Can I get help? These things you should actually say them. It shows it enriches the trust when you tell people that what are your limits. It enriches the trust in the Swedish system. I say I know that it's different in other countries, but in Swedish system it enriches trust when you tell them, you know what, I haven't done this before. I would need help in this, or I've done it long time ago. I need someone to help me here.
And in speaking of the differences between Sweden and the other countries, Dr. Ilze, do you have any experience working in Latvia?
I worked a little bit in Latvia as all different kinds nurse assistant and nurse, a little bit as a doctor. And in Latvia, it's very, very, very different. In Latvia, you should have to be that, as I said, maybe very important and very smart person that does not make any mistakes. And for example, for me, it was a little bit shocking when I was in that introduction 2 weeks in the Vårdcentral. And for example, the doctor just opened the Google and the VISS and went in that and like, ah, wait, I'll check it on the internet and stuff like that. For me, it was a little bit like a shock because in Latvia, if you do that, the patient would faint. I would say, what kind of doctor is that Googles? I can Google myself. And in Latvia, you should not go to the computer to check anything. But in Sweden, it's completely normal. I sometimes just, for example, show them how I work, what I use. I say, oh, you see, this medicament is like, it's the first you should use, it's the second. And patient, they like it. They're like, they feel involved in the process of their, like, say healing. It's not like you do that, hey, do. They're like feeling, okay, I understand. They really like the explanation. But in Latvia, it would be very different. In Latvia, you have to know everything here in your head. You don't check anything.
And yeah, thank you very much, Dr. Ilze. And are there any other differences in Latvian system versus Swedish in different aspect of healthcare?
Well, the patients are not that nice. That's true. Hair patients, I think they're much nicer. Maybe they will like write a report on you after the consultation, but during the consultation, they usually are very lovely and great. In Latvia, they usually start screaming at you if they don't get what they want. That's something the patient, doctor, patient. And in Latvia, of course, the working hours are much longer, and the salary is lower, and there's less respect, and we need a lot of more nurses and doctors and nurse assistants, and overall the situation is quite sad and horrible, I would say, especially with the work and life balance.
Yes, work and life balance, that's of course a very
It's not
popular topic.
non-existent in Latvia, like
Non-existent.
literally non-existent.
And Dr. Ilze, is there anything which is better in Latvia in regard to healthcare if you compare
It's
to
faster.
Sweden? It's faster?
It's much faster. If you want to get a specialist consultation, you're free to go anywhere you want, but you just have to pay. And it's usually not that much, like 50 euros, 500 crowns, something like that. So it's much faster. If you want to see a specialist, you can do it. Private clinics are very popular in Latvia. But in Sweden, you have to get a referral and you have to wait. That's what I do myself too as a doctor. I've been waiting for a consultation for 5 months.
Oh, that's
Yeah.
That's a time. That's a time to consider.
In Sweden, I would say that there was one of the questions that you guys mentioned that about the role of Vårdcentral or primary care in Sweden. In Sweden, that primary care, when they decided to put primary care, or when they decided to put the burden on the primary care, they put primary care as the first line for anything. You can literally kind of not do. You literally go to primary care first when you have anything, except maybe if you have a heart attack or like you're really in pain, so you go to the emergency. But in general, most of the patients, they come for anything you can imagine to primary care. In other countries, at least in Poland, where I was, or where I am from, or where I was raised, if you have a chest pain, you go to a cardiologist. If you have a pain in your abdomen, you go to a surgeon or like a gastroenterologist or whatever. So in Sweden, the primary care system is very general. It's very widespread, and your job basically in primary care, first job is to, and Ilse can add and say if I'm wrong. First job is to exclude if that can be something that big. Then you start treating.
Precisely. Some heart attack, something acute. Or
exactly.
Something that you have to send. I had quite a lot of patients. They look nice. Everything is good. They're like, I'm okay. But you take some tests and you understand that they're like dying.
Exactly.
So it's very
some
important
patients...
to send them. Yeah. And the patient do not understand that they're dying. They're like, I'm okay. Yeah. Gonna die tomorrow, but I'm okay.
For example, in Sweden, there is a really nice system for catching cancers. And doing this, there is the remiss system that is for general stuff, but then you have a specific system that is called SVF, Snabb vårdförlopp, and this is directed for all types of cancers. You have a different SVF system for each type of cancer, and that system, when you kind of, for example, if you have a patient that you know that he might have colon cancer, or you suspect that he has colon cancer. The SVF usually goes within 3 weeks, 2 to 3 weeks, and then it's done. 14 days, everything is done. So
days sometimes. I sometimes got
sometimes it's days.
in days. Yeah,
Exactly.
it's like everything is, but sometimes it's better to send via that SFE as SVF than to like. It's better to get that answer. Oh, it was nothing. Like, why did you send to us?
Yeah.
Than to miss something because. But it's fast.
Yeah,
it is fast.
Exactly, and there is actually regulations about SVF. You can Google any SVF you want. You can Google SVF colon cancer, and you will see what are the requirements to send the SVF and so on. So it's nothing that you need to memorize or anything. It's just once you have that lamp above your head that slings like, oh, this might be cancer, then you can go check if it fills up the criteria. And this speeds up the process. So the system itself, yeah, it's slower for the majority of cases that are not acute. But when it's something serious at the moment, it's not slow at all. It's quite quick. It takes the patients that has a heart attack, or that you suspect that he has a heart attack or a stroke, or like a minor stroke that comes to you in the Vårdcentral. Immediately you take them to the emergency. You order a car to them to take them to the emergency. In the emergency, they will get their CT immediately the same day. They will be operated, for example, if they need to, within 2 days. So that part exists. The part that actually takes time is maybe you have some arthros or some small thing that needs a gynecologist or some orthopedic doctor to check it out. That takes time. Yeah, we all agree.
Yeah, but when it's needed, the Swedish healthcare system will save you miraculously, very fast.
Yeah.
And something is very
Yeah.
serious. That's true. That's true.
And Doctor, so I had also one more question about Latvia, as we have many aspiring doctors from different parts of the world, and some of them also have actually studied in Riga. We have, for example, here Dr. Abdullah, also from Riga. In terms of salary, is there any big difference between in healthcare system?
Yeah.
It is bigger. Okay. Is it to Swedish advantage or to Latvian advantage?
Well, of course, to Latvian advantages. We get like 5,000 euros there, No, I'm joking, of course. I have actually numbers. A lot of my friends stayed in Latvia, the people that I was working with, and the one that got into the residency. It's actually quite hard to get into the residency in Latvia. For like primary care, not that hard, but everything else, it's very, very, very extremely hard. And one of my friends got in, and the salary is approximately 1,600 euros. 1,800 euros, sometimes before the tax. So it's not a lot. And for example, I have a little story. One of my friends, she got into surgery residency, but it was so much for her. So she unfortunately got hallucinations at some point and got into psychiatry house and she left. She said, I could not continue. That's what Latvia's healthcare does to you. And she left. Yeah, like 2,000 maybe max for the residents. But after that, also there's a very big difference for the doctor's salary in Latvia. In Sweden, I think it's quite similar everywhere. Underläkare get this, läkare get this, specialists get this, and overläkare get this. Everyone at the same place. Well, I think so. I'm not really sure. But in Latvia, you in the same hospital, the difference can be in like tens of thousands. So one doctor can get, for example, 10,000 euros, another one. So very not fair. Very not fair. Corruption, all that, everything is still in Latvia, unfortunately. If you pay, you get something.
Okay, you get faster treatment. I mean, if you
yeah, if you pay, like in the envelope, still there, still stuff.
Okay, yeah. Yeah, that's it's a matter of time, I guess, while it will
Yeah.
change. Of course,
Yes.
it's changed a lot.
What I wanted to say basically is that in Sweden, if you were looking to become a multimillionaire, no, Sweden is not gonna make you a multimillionaire from a doctor job, or like if you want to get really rich or so. But if you're looking to get a good work-life balance and a good salary and a decent life, then Sweden is a good choice. The only thing that I would say is real in Sweden is that work, although that you have a good work-life balance, work takes a lot of energy from you. It doesn't take all your time, but it takes a lot of energy from you. And this is something that basically this is what a doctor job does all over the world. But in general, I would say Sweden is one of the countries that is nice with work-life balance. But at the same time, going to work, sometimes you need to take 1 hour, 2 hours, 1 hour train or something. Sometimes you come back home after dealing with a lot of patients and computers, and you're just like you shut off. So that for people, I'm talking here about people that never worked as doctors before. So like I started working as a doctor in Sweden. I didn't work in Poland more than my studies and all of that. So it takes a lot of energy, but it's quite. But you have also you have the reward at the end of the week. You have your weekends, you have your semester dagar, you have time to rest. Yeah.
And one question came from Dr. Mimansa. Do you get to participate in operations as BT doctors?
That's a good question. That's a really nice question. Yes. I in my BT time, I didn't get to participate a lot. I participated in around 5-6 operations total. But in my time as a junior doctor in Uppsala, I worked a lot. I was first assistant quite a lot. So it really depends on. I would say there's no rule that tells you yes or no. My other Beta colleague, she had a better experience and assisted in a lot of operations. It depends on the priorities. So if you have a resident doctor, usually they assist. If you are working in the clinic as not as a Beta, I would say as a junior doctor or as a licensed doctor or whatever, then you're gonna assist. Definitely, you're gonna assist, and you're gonna learn a lot. And if they like you at one point, if you as a surgeon, if you get good contacts with the people that are operating, and you kind of they start kind of liking you, trusting you, you will start doing a lot of things, even as a junior doctor. They don't. There is no there is no real hierarchy in Sweden. That's what I would say. And the OR, definitely, the hierarchy is a hierarchy of responsibility. But in the university hospitals that I worked in, everyone wants everyone to learn. Everyone wants to see the juniors learn.
Okay, like for me is that if I'm hoping to get a job as a underläkare in summer, is there like a time period where I should be start applying? Like, is it now too early? Because even if I apply now, I feel like I'm not ready for an interview. And is there again?
No. It was
Sport cafe?
your inner voice.
Or is there like, is it too late if I stay like until May or April, or I don't know?
If I would answer this, apply from now. Don't be scared. I can tell you that before I got my job, I applied to 55 places, I guess. I got 5 interviews, and then I got 1 job. So you never lose with applying. Trust me.
I guess, yeah. Okay.
And the funny thing is that I got the job in the place that I really wanted. That's what's funny. So after all of that, it worked out well. But I mean, like, just apply. Do as interviews are training.
True.
So if you're not ready for an interview, go. With the time that you will get out of the interview, you will be better with the next interview. You know that. You will see, okay, I did here wrong. Maybe I should have answered like this. Maybe I should have used this word. And you will change your mind the next time until it works out.
Dr. Mimasa has also experience in that regard, by the way.
Yeah, I just wanted to say if you're applying for summer jobs, they usually put it out like few months, like at least 2-3 months in advance. And if you're applying for just underläkare jobs, they have to advertise it for 2 weeks. So if you're looking for a job, let's say like next month, apply now, like at least a month in advance, start applying. And if you're sending like applications through email, like to Verksamhetschef, then just send the email now. And if they have a vacancy, they will let you know. And usually if they have a vacancy and they have not advertised it, they will let you know and they will advertise it later, but keep you in mind, you know, like they by law have to advertise the job for 2 weeks. So don't just follow the advertisements. You should also be sending cold chain emails to many, many people as you can. So, yeah.
Okay. That's very good. Thank you. Thank you, sir.
And if you haven't worked in Sweden before, try, even if you're not graduating or need to work immediately, try to go for a week, 2 weeks, 3 weeks, anything. Try to email the specialty that you like somewhere in Stockholm, Uppsala, anywhere, and just see if there is a chance for you to just go around, to get to know people there. That's more likely gonna get you a job than sending all interviews to, or sending out all of your CVs and letters all the way. I'm just saying, if that is possibility, then do it.
Okay, that's a good tip. Thank you.
Yeah.
Hey guys, so I wanted to ask regarding the competitive specialties like ophthalmology and radiology. As a EU graduated non-EU citizen, like how realistic is it, like and what would be like a realistic pathway? Like, for example, how long do I have to work as underläkare, for example, or like generally what would be a realistic pathway to those specialties? Thank you.
I can start answering if you want. Oh, okay. Elsa has to go, so I will answer. So basically, I wanted to say that the path for such specialties is not easy, and it's not impossible either. I know people with the same like circumstances that you had, that got ophthalmology and got radiology and got surgery and got whatever specialty that you're thinking of. And I know people that from Sweden that worked in Sweden that wanted these specialties and didn't get it. So it's all a matter of timing, basically, contact, a lot of, how I would say, working in that place and coming in the right time in the right place. So if you are an EU graduate, you need to be done with your BT. You need to be working in the clinic that you are in, that you want to get your ST or your residency in, and you need to know that there is a special that they open up positions to specialty in the upcoming time. Ophthalmology is quite. They quite open a lot of ST positions each year, so that is not very difficult. Radiology, it depends where you are, which region, which place, where do you want to be? Are you willing to go around? Are you not willing to go around? I would say in Sweden there is nothing that is impossible. You can get whatever specialty you want, basically, really. That is totally not impossible. The question is how much are you willing to do to get that specialty? Are you willing to move around to northern Sweden for 5 years to do it? Are you willing to do a lot of research work, give 1 year of your time to work as a junior doctor? All of that plays a big role. Some people get tired and then they're like, okay, we go for Vårdcentral, we go for psychiatry, we go for something easier. We want to have a stability at this point of life. And that's also not wrong. But in general, it's possible.
Thank you so much.
Thank you very much for coming today. Dr. Ilze is not here, but I also want to thank Dr. Ilze for a really nice talk. And Dr. Nader, we have not seen Dr. Nader for ages. Personally, me, it was absolutely brilliant to see Dr. Nader as well, and hearing his inputs regarding BAT. That's always a relevant question, and which, yeah, you need to be in that field to answer these questions. And as said, guys, we have our communities. We have our Facebook group, Doctors Going to Sweden. Please join. We have, I guess you are learning Swedish language too at some point. We have a conversation club. You are welcome to join and practice your Swedish. We have courses. That's another story. You can get information from the homepage. And for those who were asking for non-EU pathway, Kunskapsprovet, the theoretical test, you can ask Dr. Rami. Yes, with that said, guys, thank you very much for coming today and see you in the next webinar. Tusen tack.